Creating a trauma-informed classroom. Mental health advocacy has become a topic of current interest within the media and thus in schools. There's a strong body of research indicating the need for trauma-informed services in schools, as well as the success of these programs with regard to student achievement. As an educator, I believe that there's a lack of practical strategies that teachers can use to create trauma-informed classrooms, which leads me to the interest in this research question as to how effective can using trauma-informed strategies in the classroom be in supporting student achievement, and how can educators create a trauma-informed classroom. Childhood trauma can be defined by toxic stress that is prolonged and unsupported by adults, causing physiological and behavioral upset. 1/3 of Canadians reported experiencing maltreatment before the age of 15. 65% of childhood trauma victims experienced consistent maltreatment, and 67% of victims did not tell anyone about their traumatic experiences during childhood. And child maltreatment has been identified as a global public health concern. We are teaching the whole child, not only academic skills. Academic achievement is greatly influenced by a child's well-being, and schools have a unique opportunity to offer children support and healing from trauma, as children are at school every day. Schools who have used trauma-informed approaches see significant improvements in their students' ability to learn. So what is a trauma-informed approach? This is a whole school initiative that seeks to reduce re-traumatization and healing by realizing the impact of the trauma, recognizing the symptoms of trauma, and responding to the student needs by integrating knowledge, policies, and practices. Data gathered in this research consists of document analysis of 5 main studies of schools who implemented trauma-informed approaches and policies, as well as international and national records. The studies analyzed were chosen to provide this research with a wide variety of student populations and demographics. Analysis was done based on the strategies used in the schools and how effective the educators felt they were in helping their students achieve success. By analyzing data previously collected from multiple studies, I was able to compile and compare data from various schools, situations, and leaders in education and mental health awareness, which allowed me to draw conclusions on research that reaches farther and more in depth than I could have collected through my own possible research participants. This was, however, limited by the secondary data available to me in this area of research is limited, in that collecting data specific to my research question was difficult since many studies focused on educating school staff on trauma sensitivity rather than practical strategies that have been trialed in the classroom with students. However, the studies found and analyzed did provide an overview of practical strategies for teachers that I have categorized into 6 main themes: staff cohesion, assessing student needs, relationship building, sense of belonging and safety, promoting resilience, and re-envisioning discipline. The first strategy we will look at is staff cohesion. A whole school approach requires staff to brainstorm, action plan, and reflect together. This helps students learn a common language around trauma and self-regulation, and to have a model of positive and respectful relationships, providing the entire school with a greater sense of community. Assessing student needs. Different students require different interventions. This will be true for all scenarios, including trauma. It has been found that with regard to trauma, school committees can assess student needs based on their level of trauma, which influences the intervention required. For example, higher risk students should be recommended to additional resources and given class time to work on their social emotional skills. Relationship building. Feeling connected to our environment and the people around us is also a factor that influences all persons' behavior. A student who has experienced trauma will have a more difficult time trusting adults in their lives. Educators can create safe attachments with their students by getting to know the child personally, not just academically, making it clear that the reason we teach them is because we care about their success. The students need to know that the educator is there for them, which has been shown to significantly increase student engagement and thus their achievement. Sense of belonging and safety. Along with having a safe attachment to their educator, students are also more successful when they feel that they belong within the school community. This can be done through promoting access to small groups and clubs with a common interest, having a school-wide value on inclusion, taking restorative and community approaches to discipline, and setting consistent routines. promoting resilience. Who have survived trauma have a lower ability to self-regulate their emotions. Educators have this unique position to teach these skills on a consistent basis. Classroom activities that are rehumanizing, inclusive, and positive can help to teach coping and relationship skills. Re-envisioning discipline. Punitive approaches to student behavior show a negative impact on students already facing toxic stress in their everyday lives, especially in punishment that highlights the voice of adults versus the accountability of the student. Schools who use restorative approaches, collaborating with the student to find supportive solutions, have seen a significant decline in office referrals for discipline, incidents involving physical aggression, and out-of-school suspensions. Educators can create this restorative culture by involving all of the persons affected by a behavior incident in the solution to the incident, interpreting and responding to the behavior through strength-based approaches, and using redirection. In conclusion, educators have a unique opportunity to lead students who have survived trauma toward healing and away from re-traumatization. Within the school system, educators may build positive and trusting relationships with the children they teach every day. Trauma, relationships, and accountability are interconnected and shape students' experiences in schools, thus are important to prioritize when aiming to increase school success overall. There is a need for professional development for educators in the areas of creating a safe and inclusive atmosphere within the classroom, teaching social emotional skills, and creating trusting attachments with all students. More primary research is required to adequately trial and assess trauma-informed strategies in classrooms. This is an area that can be further developed and studied so that teachers can learn and use them to help their students heal from trauma and achieve academic success.